are back.
What is up, you skiffy soldiers? Get back on your ice cream cone. It is time for season 2 of 3 PTs in a Pod. On this
Season 2.
Yeah, season 2, first episode of season 2. We've got we're going to talk about clinical. So we just finished our second full-time clinical over the summer, and we're going to talk a little bit about third year of PT school, which we just started a couple weeks ago. All right, guys, welcome back. So 10 episodes are in the book, season 1 complete. Starting season 2 today with the crack of the monster.
Nice crack.
With the crack of the monster.
That's how you begin season 2.
Season 2, episode 1. So the boys are back. Just got done, I guess. Well, we're already into the fall semester of our third year, but we just finished second full-time clinical over the summer. So I think we wanted to start with talking about that today. So let's just start off with where we were over the summer, sort of the setting. It was a 6-week full-time clinical. So Artem, where did you go for those 6 weeks?
So I was at a select medical branch called Concentra. So what they do is all like workers' comp stuff. So I primarily worked with injured workers.
Okay.
Yeah.
Gotcha. KP?
I was at NovaCare, which I think we talked about before on one of the episodes, but I was there for my last part-time clinical, and I was there again, and I had the same CI. So it was nice to see a familiar place, but we saw a lot of outpatient, general orthopedic stuff, but also a little bit of neuro, a little bit of vestibular mixed in. So yeah, it was a little bit of hodgepodge, and it was good. It was busy, but good. Yeah.
Good. And I was at a place called Life Fitness Physical Therapy down in Maryland. I think there's like 10 or 12 locations total throughout the state, I believe, just in Maryland. General sort of outpatient sports medicine clinic. We did do some aquatic therapy, though, so
Nice.
A little bit of aquatic PT. We can maybe get into that a little bit.
Yeah,
A little
I
bit
feel
of vestibular.
You had the most interesting.
Yeah, it was
of the
definitely
three.
definitely new. Definitely hadn't really seen it out in the clinic before, so definitely interesting there. And I think so. We basically left off season 1. The last episode, I think we were talking about going into this clinical,
Right, preparing for
clinic,
Yes, exactly.
giving
Now we're
some
more
tips
mature,
and pointers.
Look at us.
Yes.
We're even dressed up.
Well, we can
Name tags.
critique how our advice kind of affected us in the clinic. How if we actually followed up on what
Right.
we talked about doing.
Right.
I don't remember what I said.
Me neither, but I kind of remember the gist of it.
Yeah, we'll just wing it. That's what you do.
I remember thinking I was gonna go in way more prepared than I did.
Mhm.
I wanted to be more prepared, but life gets
You
in the
didn't
way.
think
you know?
you didn't think you were prepared.
I
as
thought
you
I
should
did
have?
fine, but I think I wanted to be more I wanted to be more prepared.
Mm-hmm.
But I did fine.
Okay. Well, as
How'd
long-
you do? Why you grilling me?
No,
dude?
I went in really prepared and like I just
Oh, okay,
crushed
dude.
it. So,
Cool. Cool, man.
No, I just wanted
What percentage of the caseload?
100.
Oh, okay.
First day.
Okay.
So.
Okay.
Where's your card? Can I get your card?
Yeah, actually, right.
I have some knee pain.
I actually give them all out at the gym, so.
Sick brag.
Yeah, I mean, I would say I probably went in better prepared than our first full-time one.
For sure.
Well, I think we
And,
just knew more.
Definitely knew more.
Like, I don't think, like,
Just knowing what it's like to be in clinic
Right.
full-time, I guess, that just makes you naturally more prepared. But I do think I did look at some stuff before going this time. And I think overall, though, I do think I kind of agree with UKP in that, like, you're always a little bit behind the 8 ball with where you'd like to be. But some of that, again, is what we've talked about in previous episodes. Like, you just always want to do better than...
yeah, that's just being hungry and, like,
Right,
wanting
yeah.
to be better
Right.
always, so.
Right.
Like my women, I have high standards, you know.
Nice.
Sick, dude.
I guess, yeah, that's why, like, I wanted to go in, like, knowing every single muscle, origin, insertion,
Yeah.
action, nerve, and I just shot the bar way too
Well,
high.
and there's, yeah, I mean, you can like pinpoint a couple areas going in, but then once you get into the daily grind of like having to handle different patients coming in with
Exactly.
different stuff, needing to worry about documentation, fitting everything in a timely fashion, then it sort of all goes out the window and you just have to approach like the most important thing in that moment
Yeah.
and do that.
Spot on.
And, then if you have time to go back to things, but if you're working long days, 10, 11 hours, there's obviously other things you want to be doing over the summer as well. So it's definitely tough. But
Yeah, you can see how like when PTs get out of school, they kind of lose track of like keeping up with like all the evidence and like going to all these courses. You can see how that could possibly happen, but you still have to make the effort.
yeah.
Yeah.
So how'd you guys, did you have a big clinic, Artem? I think yours was pretty small, right? Just you and your
The
CI?
physical clinic actually was pretty big, but it was just me and my CI. It was the summer, so funny enough, our biggest the Concentra's biggest client for that location was like the school district, but none of the teachers like to get hurt in the summer because they have summers off, so they usually like to save their injuries for the school year so they can get some paid time off in the school year.
Nice.
So that patient population was kind of not there.
Mm-hmm.
So it was
You had
not.
summers off, too. Congrats.
So it was. So it
So you
wasn't
didn't do shit.
So you saw 100% of one patient.
pretty much.
Dope.
Great.
He got better though.
Yeah, we'd like to see you for 5 times a week for 6 weeks.
Please.
That's as long as I'll pay you.
Just that.
Just tell me what you want me to treat.
No, but I mean, we saw probably like 8 to 12 patients a day. It wasn't the busiest clinic on the planet, but it was nice to have like one-on-one time with each patient. You could do your manual stuff, you could do whatever, and then have time to discuss treatment plans with your CI, and then even like have time to practice things on like she would teach me stuff, and then yeah, that's coming. I was waiting for
What
it.
did she teach you, dude?
What does she look like?
Oh, dude.
She
I
looks
can't discuss it on this podcast.
engaged man.
Yeah,
You forgot to
yeah,
say.
hey,
Oh,
congratulations, man.
Not to my CI.
Engaged. Yeah, no, not to your CI. But yeah, congrats on that as well. That's big
Thank
news
you.
over the summer. I would also add that I think that's like spot on in terms of that maybe anywhere from like 6 to 10 patient range is I think really like the sweet spot where I found like not only can you give your best treatment to the patient and be as prepared as possible, but also like you were saying have the time to discuss with your CI treatment plans and like kind of why you're doing certain things, if they would do something differently,
Right.
if they have any suggestions, and also getting your documentation done. Obviously, going into our upcoming ones, we want to be able to handle a little bit more, but
Yeah.
I found too, like for the second full-time one, when I was at about 8 patients a day, give or take a few, that was where I felt like most comfortable
Yeah.
and not like overwhelmed, and just kind of in a good groove, good
Yeah.
rhythm.
Like besides like the hands-on stuff with the actual patient, I found that like one of the most helpful things was like actually talking to my CI before like a patient even comes in. Like she'd be like, all right, what are you like thinking of doing? What do you think like they have, or like what do you think their prognosis is? And just like sitting there going over it in my head, planning, discussing it with her, and going back and forth, like that was super helpful to kind of develop that clinical decision making.
For sure. What about you? KP, was your clinic?
Yeah, so a little bit different. So a lot of techs and a lot of PTAs.
Okay.
There were about 4.
So you didn't actually do shit.
Well, here's the thing. So there were like 4 PTAs on. The schedule is all messed up. I'm not even gonna explain it. But for the most of the week, there's 4 PTAs and 2 main PTs. But one was also the manager of the clinic, so
Okay.
he only treated on like Monday, Wednesday, Friday. And he didn't he had like a certain patient population that he worked with. So he did a lot of like the peds and like a lot of the evals, but we also did some. And then we had like 3 or 4 techs at any given time, but we were also seeing 15 to 20 per day per therapist.
Wow.
And it wasn't that big of a clinic. It was a cool setup though. So all the treatment rooms were around like the perimeter, and then all the equipment was inside. So like you could go into a treatment room, do all your manual and table stuff, and then just come out for exercises. So it was good to be busy, but it was like you were saying. By the end of it, we were seeing like 15 to 20, and he was wanting me to see like 90% of that. So there were days where I was treating and documenting for like 15, and that's when I was like way over my head at first. And
but I guess there's like pros and cons to both of that, because that's sort of like is it baptism by fire? Is that like
basically, yeah.
You
and
know,
that's what
so
I told
like,
him too. I was like, look, this isn't gonna be perfect, but I understand like what you're trying to do, because he was a young CI, and he like knew like what I knew, what I didn't know, and he sort of just let me do things and sort of just like lurked in the shadows, just making sure I wasn't like gonna kill the patient, but he was also just like there for any questions. He was great. I highly recommend him. 5 stars.
5 stars.
But yeah, by the end of it, I was like, dude, there's no way I'm gonna be able to do 15. And then he's like, no, trust me. And then by the end, I didn't kill anybody, and I was seeing 15.
Did you like? I know, like in my last clinical, it was kind of like that. I was at Novacare as well. You get into like this, like almost like flow state.
Yeah.
Where you're like, this patient's doing this. You're like, go do that, go do this. Like you're working manuals, and you're like, I fucking got this. Like, dude, this is awesome.
Double bookings is like you said, the best like baptism by fire, because you set them up. So there's 2 rooms side by side. So it's like, all right, I know this person gets traction. We need the traction room for this one, but I also have a 1030. Back pain. So let me get this room right next to it. That way I can switch over in case they need anything. And then it's like, all right, I'll work on table exercises while this guy's doing, exercises out in the gym. And then when he's done with those, I can switch and do manual and have a tech help me out with the exercises, doing like step ups or something that is not that cerebral in exercise, which sucks because you want to like look at your patient the whole time, make sure they're doing things right, but. At that point, it's like double bookings and making sure you're treating the best you can.
Get, right?
Yeah.
I mean,
and then taking the laptop, documenting while you're treating. You find ways to make it's time management at that point.
I was gonna say you really develop like time management skills and like planning skills, because you have to plan all that ahead of time. You can't just be like, all these 4 patients coming at once. You're like, fuck, what do I do? Like, you need to make sure you look at the schedule, like, and figure out kind of like exactly how you said, like, you're gonna put this patient here, put that patient here, start them. Maybe don't start them with manuals right away. They start with like on the bike or something. Then you do manuals. Like, that's all really important skills.
Yes.
And for the most part, patients were willing to do those things, but some patients who have been there for a while, like a certain order, and being there for only 6 weeks, you don't really pick up on that till about like 5 weeks or 6 weeks, right about when you're time to leave.
Right.
So if a patient likes to do their exercises, then I like to finish with you like massaging me, they'll say, and it's like, yeah, we're doing manual work, we're not masseuse. And then so it's like, all right, you got to keep that in mind to make sure they're getting the best treatment, but sometimes you have to sort of convince them, and that's when it takes your personal skills of let's try doing exercises after manual, maybe we'll loosen things up, and it's just like the tone of voice, and then like it's honestly manipulating them, and like with your words, I found to just try things. Dude, I was
But that's the thing, communication, efficiency, time management. Like, you have to be, I think, look for the positives, no matter what side of the aisle you sort of fall on in terms of the clinical experience you get, whether it's like the slower paced, maybe 6 to 8 patients a day. You really get to sort of like hone your clinical decision-making skills, your interactions with patients, your time with patients, your hands-on skills. Or are you getting the time to work on having to be efficient, having to have proper time management, being able to manage the other people around the clinic that you're on the same team with in terms of PTAs and techs, and doing all those things? That's a whole nother skill in itself that we don't really get in school. I mean, the most hands-on type patient treatment might be if a patient comes into lab one day and we're working sort of as a group, or if you're doing a practical, that's obviously you one-on-one with someone showing your skills. So take advantage of those opportunities as well. So you really can't have like a bad clinical experience, no matter what. You're going to be learning something, and it's just having, just understanding that and being, just taking it head on and going for it and getting the most out of it. I
Yeah.
think.
That's the best part about clinical is that you can't have a bad experience. You could be in the worst place with the worst CI, with the worst
Yeah.
patients,
Still gonna teach
and
you
you're
something.
you're gonna learn something.
Yeah. Even if
that you
it's
weren't
like
taught in school.
something like I don't want to do this.
Yeah.
Yeah, that's almost just as valuable as
Yeah.
seeing like. I mean, I think we've all had good luck with having really good CIs and like learning from good clinicians, but even if you don't, like getting modeled the bad way can be just as useful as getting modeled by someone who really knows their stuff and is like someone you look up to. So.
Plus, you might not go into aquatics down in
That's
your
right.
professional
That's
career, but
right.
you're gonna nail the questions on the
That's
exam.
right. So there's no bad clinicals, there's only bad mindsets.
There
How
you
about
go.
that? Put that one
We're
in your
done
back pocket. So what did you guys, so we've talked sort of about schedule. So what was like your schedule, daily schedule, just to give people an idea of what they'd be looking at with like a full-time clinical weekly schedule?
Like you mean like the work schedule?
Yeah.
So
just like
every day was 8 to 5.
Monday
so we
through
had
Friday,
like
8 to 5.
Yeah, Monday
Jeez.
through Friday, 8 to 5.
I could see the gray in your
Uh,
face, dude.
No, I mean, I
Sounds
thought it
miserable.
actually, like, the days went by super quick. It sucked not having, like, a short day or something like that. And, like, it really sucked on Fridays because, like, it was Concentra's in urgent care. So a PT, even if they don't have patients from, 3 to 5,
Mhm.
they have to be there because there's walk-ins. So, like,
Right.
people walk in, they get injured at work, they go to this urgent care, they see the doctor, the PA or whoever's there, and then the doctor could send them, like, could send a script for PT. So then they would just walk over
like that
for an
day,
eval
that
that
second,
day,
yeah.
like right after seeing the doctor, and be like, "Hey, could I just do my eval now?" That's another skill that
That's
I had to
huge,
get
yeah.
really good at, is because
You don't
your
get a script.
your evals have to be 20 minutes.
Yeah.
Wow.
Like, these people are like, "Hey, I have to leave." Like, so you have to distill like all your subjective. Like, you really have to guide them through, like, to get them in and out, get all your like physical exams done. 20 minutes.
And that's another situation, like you can bitch and moan about that all you want, but that might be the situation you're in. So you either like adapt to that
Adapt or
and
die.
figure out
That's-
how
you
to
gotta
fucking
adapt.
do a 20-minute eval or
And
you sink.
You could
know?
have 2 patients and then a walkover
Aquatic.
comes in.
Nice.
You could have 2 patients, a walkover comes in. You have to figure out, okay, like, how to either like delegate like the care to your CI and like you're doing the eval or something like that, or like you tell the
Right.
patients what they're doing as you're doing the eval. So like that was, in the beginning it was a little stressful, but like you kind of just get the flow.
And that management, like that also comes back to what we've talked to like countless times in terms of like confidence that patients will have in you. Like if you're running around like a chicken with your head cut off and you like look like you're stressed and can't handle what's going on, that energy is like picked up on by everyone in the room.
Yeah.
The techs are going to notice that, the PTAs, the patients, like those first couple weeks of clinical, you have to show that like you know your shit and that
Yeah.
you're confident and that they're not going to be taking like a step down in the treatment that they get by
Yeah.
working with you. Like that's the worst thing, if they're like they can tell that they're not getting the same care as they're getting from like your CI when
Yeah.
they were treating them, so that now they're like, oh well, why did they just pass me off to the student? So now you could be screwing over like your CI too. So having that skill as well is huge in terms of the patient being confident in you
Yeah.
too.
And,
So-
and I think, I think a lot of students get that way because I know my CI, like, I think during the first week, I don't know how many patients I treated, like, one-on-one, maybe like 4, and she's like, all right, like, let me know if this is, like, overwhelming for you. So I'm like, what kind of experiences did you have with, like, other students? Like, this is fine. Like, give me more.
Right.
Yeah, I think all 3 of us
Nice.
kind of do better with, like, under pressure.
Yeah.
And that's what I need. Like, I'll get, like, lazy if, like, I'm
Mhm.
not
Yeah.
seeing, like, a bunch of patients, not doing a
Lethargic.
bunch of stuff.
And there's
So-
another way to differentiate yourself. You know, if other
Yeah.
students are obviously coming in and they're not able to handle that, then she's going to be more willing to give you like
Yeah.
even more
Yeah.
responsibility.
And that's
so.
you have to make a note in the beginning, whether with your actions or like actually telling your CI, like, hey, like I can give me more,
Yeah.
like I want to do more. But
yeah.
yeah,
What about your schedule, KP?
I was Monday 7 to 5, Tuesday 11 to 7, Wednesday 7 to 5, Friday 7 to 1. So it was all over
Okay.
the place, but I stayed with my CI schedule, and then there were other therapists on other days. So the clinic itself is open 7 to 7 on every day, except Friday. They close at like 3. And I mean, I like going in at 7. 7 to 5 is sort of a long day, but I mean, it when you're that busy, it does fly by. It went way quicker than last year's, just because we were seeing way more patients.
Yeah.
And then 11 to 7s on Tuesday, Thursday was fine. I mean, I did stuff in the morning, got it all done. So when I got home, I didn't really have to do anything because 7's kind of, close to bedtime nowadays. And then for the most part, on Tuesday, Thursday, we were the only therapists there. So my CI was the only PT. So we saw all the evals on Tuesday, Thursday. So again, getting a lot of reps with evals, and like making a plan of care. So that was really cool.
Nice.
Found out like a lot interprofessional work. So like what PTAs are able to do, what they're not able to do, and how you like sort of delegate like what patients should be seen by them.
I think we should have an episode on that at some point this season, like how to handle that relationship.
Yeah.
'Cause I think that's something that's difficult as a student
For sure.
to like get a feel for and really like get comfortable with.
Even the techs, and it's like like some of these techs are our age, and it's like, all right, go do this for me. It's like, who are you? You're not even on salary.
Right.
You're here for 6 weeks. Don't
Right.
tell me what to do. And that's not what their mindset at all. But it's like, oh shit, what if they feel that way about me? Like I'm the new kid on the block. I'm not gonna go tell, this person to go like get me a hot pack. Like I could do that in 10 seconds.
Right.
But at the same time, it's like, all right, but I need to go document this and
they are there to do a job.
Exactly.
So,
but it's like totally mindset.
Yeah.
We can talk about that
that
forever.
could be like a whole episode. Yeah.
But yeah, how's your schedule?
I would say more similar to yours. We were, I think 7 to either 3 or 4, kind of however the last patient ended up working out on Mondays, because we would do the pool like halfway through the day. So we'd leave at like 10, go to the pool, then come back for a couple hours. Tuesday we were like 7 to 12, so a pretty short day. Wednesday we were 7 to about 1, which we would just end with the pool. So we'd leave at like 11, go to the pool, be done at 1. Thursday was our long day. We were, I think 8 to 7 on Thursdays. It's like 10 or 11 hours. And then Fridays were 8 to 5. So we'd take the last patient at like 3:45, 4 o'clock. So yeah, pretty good. I would say along with obviously, so the aquatic therapy we were doing, obviously it wasn't like inpatient or in a hospital where you have a true like therapeutic AquaWorks? No HydroWorks pools, but so it wasn't like, so it was more, I would say, your typical, kind of chronic low back pain that they're trying to figure out some way to manage and get the person moving and be a little bit more able in their daily activities. And we had a post-op ankle surgery patient who was in the pool. So pretty, typical sort of orthopedic type stuff, post-surgical and kind of low back pain that we mostly saw in the pool. And I would say one of the things that was pretty interesting, which will kind of segue into my next, probably last question for you guys, was a lot of the patients we saw just day to day, I would say, were more on the chronic pain side, which was interesting. So a lot of like lower back pain and neck pain that had been going on for like years. So, or maybe multiple surgeries on a certain area, things of that nature. So that was definitely something new for me, and just a different type of like ability you had to have in terms of your communication skills, more so than like the skill of your hands-on treatments to really manage those patients and their plans. So that was kind of my question. That was what I did my in-service on, and I think that's Artem similar. You did something similar. I'll let you get into
except
it.
for the other side of the population.
Yeah, exactly.
Had they received pain management care before, or was that why they were there?
So no, they had not, and they weren't necessarily there for that. It was just that's what we were like treating them for, just like a low back pain or a sciatica type thing would come in on the script. But so anyway, but me kind of having somewhat of a background on like therapeutic neuroscience education and chronic pain management, just from some previous, reading and interest, I kind of saw that in the patient and like the subjective interviews and sort of how they presented when we would eval them. So that's what I did my in-service on, therapeutic neuroscience education and teaching about chronic pain and the way to sort of manage that through patient education. And hopefully I think we could do a whole nother episode on that as well. So we should probably do that some point this season too. but that was my in-service. So what did you guys do your in-services on?
So my in-service was therapeutic neuroscience education, but for the acute population, because of Concentra, like since they're work-related injuries, I would sometimes literally see the patient the day they got injured. So like the whole rehab process, that was like a really big learning. That was probably the biggest lesson I learned, was like how to deal with acute injuries. You know, these people, you know, they're still in like the inflammation stage, and like they could be really painful, and you have to kind of learn how to, like, dosing was probably of exercise was probably like my biggest problem, because sometimes like I'd be used to treating regular patients, give them like a bunch of different stuff to do, and
Would you say you overdosed?
Oh,
yeah, actually, that was my biggest thing. That was my biggest mistake starting off, is like I would do too much with these patients. And
big of you to admit your mistakes.
yeah.
Are you
Yeah.
seeing anyone for your overdose problems?
I'm in rehab right now. PT. though.
My name's Artem. I've been an overdoser for 3 months.
All right. Anyway, so my in-service is also on pain education, but my goal with the pain education was to prevent the transition from acute to chronic pain. So like my idea was, like, if you can catch these people that might have like those psychosocial factors, the yellow flags, that could potentially, especially work-related injuries, that's one of the biggest yellow flags, is is like if they get hurt at work and they don't like their job, they don't like their boss, like
Yeah.
Mhm.
that's easy to transition to chronic states. Like if we
Mhm.
could catch that and educate them in the earlier stages, like that could potentially prevent them from transition to chronic. So that was my goal, and it worked out really well. And if we do a episode on that, like there's a lot of like good analogies and even like drawings and pictures that I learned throughout that process.
Cool.
Pain's hard to talk about because you don't. It's like not something you see, obviously, and it's something like you can't just tell someone like, oh, it's, you know, it's really not as bad as you think it is, and if you keep thinking it's getting worse, it's just going to keep building on each other. So
Yeah.
that'll be interesting to talk about.
Yeah. I think it's
Um,
definitely underappreciated too as a
yeah.
whole. I think it's becoming more understood and like well known and accepted, but
Yeah.
yeah.
I did core stabilization exercises. Tried to shy away from the TA draw.
Nice.
Um,
As
give
well
it
you
a
should.
Flip the script.
Yeah, that's right.
And then it got really boring and like really easy, so I included some postural restoration as well in there.
Nice.
Did a little,
Nice,
a
dude.
little bit of 90-90 hip lift.
Okay.
Started incorporating it into the treatments too, and got a 100% improvement after one treatment.
I mean,
It's
speaks
just
for itself.
A case study.
Pilot study.
No, but just reading up on it just taught me a lot, and even like functional anatomy wise, like why
Yeah.
we like movement patterns and everything like that. Really cool to look at if you're interested. Totally, do it because it it can also work up the chain. It could even help with like breathing, obviously, and even like respiratory, CO2 levels. It got that in depth, and I went that in depth in my in-service because
Awesome.
I was pretty stoked about reading about it, and my CI was too. He asked me for more articles, so we got
Awesome.
another guy in.
Nice.
Great. And that's Postural Restoration Institute,
Yes,
PRI,
PRI,
if you
yes.
want to look into that more.
Yep.
Cool.
Yeah.
Awesome.
That's cool. Good
Yeah,
for you.
that's really cool. So basically we'll try to wrap things up within the next couple minutes here. So that sets us up now. We're back on campus for 8 weeks. So we are now technically third year PT students. Last 8 weeks of didactic work. So that's basically where we're at now. We have, 3 classes that we're wrapping up with. I'm not sure how other programs do things, but that might be something if you're thinking about PT school as you're getting into your third year, that might be what you're looking at. 8 weeks of classes, and then we go right into our last 2 full-time clinicals. So we have 2 12-week clinicals coming up starting in October. So that's basically where we're at. A little white coat ceremony next week.
Yep.
And we'll pick it up with hopefully weekly episodes from here. I think we already have a couple topics we definitely want to touch on. I think definitely pain science and pain education. I think definitely management of like other personnel around the clinic and how do you work with them as team members. And we'll see what else we get into and what other topics we want to cover, but probably another 10 episodes coming your way.
Maybe
So-
we'll have some
Season 2.
groundbreaking research. To,
Oh, yeah.
we didn't even touch on
Just
that.
broke ground today on the old...
Stay tuned. You have to tune in next week now. to
Tune in
find
next
out.
week. All right. See you guys.